I'm a resident of Nairobi, Umoja State. I hail from Kisii. I am in the legal profession. So for many years, since I was born up to the year 2019, I had good health generally, without major health complications or attacks. So by late 2019, I developed some tight chest. The chest was so tight, and I didn't know what was it. By December, I was not able to carry little luggage, as little as say breakfast. Nanunua mkate na maziwa for breakfast. Naenda nayo nyumbani. My house is in 3rd floor in the apartment, so I have to walk up the stairs. It was very tedious. It was as if I was carrying a very heavy load that was pushing me against my upwards climb of the stairs. Sometimes I needed to call my family to come and help me, and obviously someone could wonder, tukuje kusaidia kubeba maziwa na mkate. That could be a joke. I needed help, so there was a joke of kusaidiwa kubeba maziwa and the real assistance of carrying it. Finally, I could make it to the house. I could need rest beyond the usual as previously was. So one fine day, it was so tight that I had been going to the hospital. Tests were done for pneumonia. So one of the fine days, it was so tight and I had to change hospital. So I went to Prudence Cottage Hospital, situated near my place along Kangondo Road. So the doctor there asked me to, it was a bit late in the day, but he organized for a specialist from Aga Khan Hospital for X-ray to do me tests on my chest. So the specialist from Aga Khan came, did the chest tests by X-ray, and found out that there was a fluid. Medically, they call it pleural effusion fluid. So I went various tests, and I was sent home by March, but there was no diagnosis. At that time, I was weighing 40 kilograms. 2 days later, I saw a private practitioner who asked for a biopsy test hapa kwa shingo. So a biopsy tissue was removed. It was sent for a test. The results came later. They saw something they couldn't describe medically. The tissue was sent for further analysis and tests. So finally, the results came in 2 weeks' time, and I was told that I had what was called follicular lymphoma cancer grade 1. I didn't know what follicular lymphoma was, but I was able to pick the one term, cancer. The news was hard to swallow. I swallowed it. I was able to smile at my doctor. He asked me, "Why are you smiling?" I told him I have known my problem since late 2019 to now, my first week of April. I didn't know what I was suffering from. Now I have known. So I was from the unknown to the known. That gave me at least a ray of hope. Even if it's treatment, I could start. I had friends, family who were wondering, how you sick? situation I couldn't explain. Some guys rang me from far and wide out of the country. We have heard you are sick. What's it? I couldn't tell them because my tests were coming negative. Though weak and frail, some thought at the time that it might have been COVID-19 pandemic, which was spreading like a whirlwind. So any imagination could have been. Reason why I was sent home so that I managed myself there away from the hospital setting where most patients and even doctors dealing with the COVID cases were, to avoid infecting me. So fast forward, immediately my doctor told me about my cancer cell in me, that's follicular lymphoma. He engaged me on a treatment plan, referred me to a pharmacist who also engaged me and told me we can manage this kind of cancer. I started treatment. Pain and discomfort were part of me. It was stinging. The fluid having been removed, I relaxed a bit, felt a relief, but there was also fatigue. Cancer is a rarity, so don't wait for symptoms. Some symptoms may come that you don't know. I had symptoms which I didn't know. Some don't have symptoms completely. You find yourself in stage 4. Stage 4 should not be a problem to you. Let it be a problem to the doctors to diagnose and apply the suitable medication. So the sooner you get diagnosed, the better. So don't wait for sickness. Nowadays, our hospitals are doing screening. Find time, walk in, peace in. Many people have walked in and have found to have been sick with the cancer. They didn't wait for the bed. They simply walked into it. So find time, peace in. We have got referral challenges. Wherever you are, some of us have villages. How do we help our village people to know that we have got cancer cases unless we come out and we appeal to them to be seen? Health organizations, support groups, make inroads, make networks, do outreaches so that the people far and wide are seen, to be tested, to get treatment. Otherwise, there will be a challenge from the village because most diseases have got common symptoms and signs. So how do you know this is cancer and this is not cancer? You could be having a headache, you could be having nausea, you could be having vomiting, diarrhea, and such like. So unless you are tested for determination, you can simply say, oh, I'm sick. You'll be given a painkiller. A painkiller cools your pains. You think you are treating yourself, or you're okay, because you might be okay for some time, but the disease is inside. So it needs to be treated. And then to our health care system, they are doing good work, but they can still do more. There's a challenge in diagnosis. In some cases, either there's wrong diagnosis or no diagnosis, yet there's a disease. So the healthcare system should work on especially equipment for appropriate analysis and determination in diagnosis.